to promote collaboration among the trainees to conduct pancreatic research and basically also propagate and garner more interest in pancreatic research among trainees. So those would be our two missions, and we've been holding this teleconference for, I guess, close to a year now. And one of the new things that we've started doing was to host a renowned pancreatologist like yourself, just to serve a couple of purposes. One is to, I guess, inspire younger investigators, and to just help promote networking among people in different areas in the States and also around the world. So that's kind of our goal in continuing this on a regular basis. We do this every month, and we pick a different theme each month, and then basically host our pancreatologist to go over some of the questions that we prepared in advance. Now, this being the Sunday here in the States, the attendance usually is a lot better than this, but I do apologize. We just really messed up I messed up the timing, and
don't worry about it.
But we're just really honored to have you here, and thank you so much for deciding to spend some time with us.
Thank you for
and we do record this meeting, and it will be there on the website, so others can also watch it later. Okay,
that's fine.
So this month theme this month really is collaboration, and obviously that aligns with our mission as a committee. And given your extensive work in collaborating with other centers, we were hoping to kind of go through some of the questions that we prepared in advance and hear your thoughts.
Okay, you asked me first a brief history, a brief story for my involvement in research. Well, I did my gastrointestinal fellowship in an 800-bed third-level hospital here in Alicante, in Spain, where I work now. This is a small city, 300,000 people in the coast of Spain. And my boss, who was Miguel Perez Mateo, was an internist and was a very, very clever man who loved clinical and basic research. In those years in Alicante, we are talking about the year 2000, there was very few clinical research performed here, almost nothing. And Miguel promoted in the gastroenterology department research first by creating specific units, a liver unit, a pancreatic unit, and later an inflammatory bowel disease unit. So my first lesson was that to do good clinical research, you have to focus your daily workload on a specific topic, which is quite obvious for all of you. Then I started my fellowship and became involved in research in acute pancreatitis. We were the only group in Spain doing research on clinical acute pancreatitis. So we had national as well as some international recognition on this field. So my second lesson was that if you make research in a field focused by few people, that increases the visibility of your work. I finished my gastroenterology fellowship in 2004, and my boss offered me to be in charge of the pancreatic unit. And I really wanted to do research, but I had limited statistics and research methodology knowledge. So I did a 4-year research methodology master and started slowly to design my own simple retrospective and prospective observational studies. So my third lesson was that it is very important to have a solid methodological knowledge to do good research. I started to design, perform, and publish observational studies, and then I realized that it is not difficult to publish studies if you work very hard, but it is very, very, very difficult to change real clinical practice. It is very difficult. It is very difficult to improve real clinical practice, and this can only be achieved by means of collaborative multi-center studies and especially, but this is very difficult, multi-center randomized controlled trials. And for that, you need grants. And for grants, you need to have performed a previous good career publishing observational studies to have a good curriculum. So my fourth lesson was, you need to do a successful research career in order to perform studies that are really useful in order to have grants and to develop your leadership skills. And this is how more or less I became involved in pancreatic research.
That's an excellent excellent overview, and just filled with wisdom and insight. Thank you so much for sharing your story with us.
Thank you.
And we really hope that the recorded piece of this video would be helpful to other trainees that couldn't make it today, because I know there are several of them that wanted to make it, but just because of the last minute time change, they couldn't. So once we post this, we'll let everybody know so that they can benefit from your advice too.
Okay. Sorry.
So moving on to the second question. So what are the key elements to a successful collaboration?
Okay, in my opinion, the first is a good leadership. A good leader is the one that is able to have an interest research question and a good and feasible, and this is very important, it has to be feasible, plan to answer it. The leader should be respected by the team. The leader should be perceived as a fair and trustful colleague. And finally, and most important, the leader should have good skills for motivating enthusiasm to the whole team. We are physicians. We usually have a huge workload, and to make research is very, very difficult. The energy for a good clinical study should be enthusiasm, an eagerness to perform the study, to finish it, and to answer the clinical question. The second point is to have clear rules for authorship and the possibility of collateral studies for the study collaborators, that we will talk about it later, and to have a good database and ways to clean and correct possible errors to have good quality data. This is very, very important.
I see. That's very helpful. Yeah, we could probably just go down these questions, and I'll let you talk, Dr. De Madaria, so that I don't interrupt.
So you asked me about the three most challenging situations you face when collaborating with other centers. This is a very interesting question. The first one, when I did my first prospective multi-center study, it was a national-wide cohort study involving 23 centers from Spain that has been just accepted in Annals of Surgery 1 week ago. I offered the possibility to the collaborators of storing the data on an Excel file or in an Access file to help everybody to use different platforms. Due to an error, there was two slightly different Excel files, and at the end of the recruitment period, we had 1,600 patients, and to join all those data in a single database was very, very difficult, and it was a very hard job. So my recommendation is to use a web-based, robust database like REDCap. You know REDCap, I'm surely is the one used in the apprentice study. That is a successful study from the Pittsburgh group. And so a robust web-based database is important, and now we have tools to have a free web-based database. Second is that you may recruit many centers for a collaborative study, but you have to know in advance that many of these centers will not recruit any patient at all, or some centers will recruit 1 to 5 patients and then they will stop there. So only a few centers will work hard to recruit many patients. You have to keep those active centers motivated because they are the key for success. And don't feel bad regarding inactive centers because that's part of the business. And the third point is that when a study is not working and is an ambitious project, you have to react. We are currently performing a multi-center randomized controlled trial and recruitment is very low. So we are trying to motivate the centers. We are trying to enroll more centers. We are looking at the inclusion and exclusion criteria to see whether it's worth to change some of those criteria. You have to react when the study is not working properly. The next question is, how do you sustain a collaborative relationship between centers? This is very difficult. This is a leadership skill that is very important for keeping active and study. Firstly, I try to talk often with my colleagues to thank personally those centers with a high recruitment rate. Secondly, rules are made to reward all the study participants with at least an authorship in one paper. We will talk about it now on. And finally, we offer the final database for collateral studies to anyone willing to do so. And these are the keys for successful collaboration. Regarding authorship is a very important issue. In fact, it's the issue of collaborating studies. Our strategy is to have a main project for a high impact publication, or at least the highest we can aim to. Those centers recruiting a higher number of patients will be co-authors in this main paper, the strong paper. We try to include the maximum number of co-authors as possible. The more authors in the main paper, the better. For example, in this paper in Annals of Surgery, I think we had 26 authors and we had all the collaborating colleagues acknowledged, but there were 26 authors. With a main project to answer a clinically interesting question is very good to generate enthusiasm in the team. Then you have the collateral projects, studies, led by members of the team, different members from the people that are leading the main project. And this is very good for many of the authors to be motivated to enter patients because they feel that those patients will be part of a whole project and they are part of the people that will profit from this collaborative study. So, for example, the main project of this Annals of Surgery paper was to validate the severity classifications of acute pancreatitis and to see which are the real determinants of adverse outcomes in acute pancreatitis. We have 23 centers from all over Spain, 1,600 patients.
Wow.
We have this main project, and then we have 3 other collaborational studies from that database. 2 of them are currently under review. So using this main paper and the other 3, we are able to include all of the colleagues that have participated in the study as co-authors of at least one paper. You can interrupt me if you want to ask something or comment.
Yeah. I think one additional trainee just joined in the teleconference. Winnie, would you like to introduce yourself to Dr. De Madaria?
Hi, yeah, this is Winnie. I was a resident, worked with Peter a lot on a few research projects, and currently a hospitalist at the VA, and I'll be a GI fellow at UCLA next year. Okay,
nice to meet you, and welcome.
Nice to meet you. Thank you for leading this conference.
It's a great pleasure.
So yeah, Winnie, Dr. De Madaria is in Spain, and that's why we had to change the time. But he has extensive research experience and very prolific in publications and collaboration. So we're just discussing the theme of collaborative research. we're just going down the list of questions that we had for Dr. De Madaria.
Okay, excellent. Thank you.
You're welcome. Okay.
We can move on, Dr. De Madaria.
Okay, we were going to talk about how the next question was, how can we optimize the consistent and high quality data gathering across all centers? This is very important issue in any collaborative study. You know, when you have a database with 60 patients, everything can be fixed, but when you are dealing with a database with 1,000, 2,000 or 3,000 patients, you need help from the database, from the software, and you need to have the clearest data you are able to achieve. You need a good database like REDCap, when you can set logic rules and expanding menus that help to have good data, and you need somebody to review the records, and that's the most difficult part. He or she must be a clever one and has to have clear instructions regarding how to clean the database. It is a difficult task, and sometimes you need a grant for that. Regarding the next exciting topics in pancreatic research, we are working in a very interesting topic, the international validation of a patient-reported outcome measurement scale. In acute pancreatitis, we need an anti-inflammatory drug capable of changing the course of disease when applied on an early phase. We need better drugs or interventions to prevent post-ERCP acute pancreatitis in non-selected populations. We need easy and accurate ways to diagnose exocrine pancreatic insufficiency. We need a major advance in treating pain in small that chronic pancreatitis. Any advance on these clinical problems would be a major contribution to clinical pancreatology. It would change the real clinical practice, and this may be some aims for the future. It is not easy to do that, but we have to be ambitious to try to change real clinical practice and to improve the patients that should be the center of our work. You ask, how can this trainee committee garner more interest from trainees from Europe? Indeed, by proposing collaborative projects between both communities of trainees. I have just been appointed coordinator of the Young Pancreatologist platform in Europe. It is the Young Talent section of the European Pancreatic Club. I am part also of the Pancreas 2000 educational program, which is working hard to teach clinical pancreatology to trainees from all Europe and is aimed also to promote collaborative research. So I am in a good position to help you to approach the young pancreatologist from Europe. Sorry.
Just to kind of elaborate on that, what we thought as we thought about a practical and feasible collaborative project that we could do without needing an IRB approval was just starting with a cross-sectional survey type study. Not that that's our ultimate goal, but just to start this process. And Adrian here with Amir have done a wonderful job of actually creating a survey where we aim to a measure of interest in pancreatic research among trainees, and two, perhaps the impact of mentors, both long distance and inter-institutional, on their level of interest in pancreatic research. And actually, the survey is kind of finalized and it's ready to be disseminated among the US training programs. Is that something that you think would be a feasible thing to do or expand to some of the European centers at all?
Yes, we could do that through the European Pancreatic Club. There is no problem for that. It's easy for us because I'm part of this strong society here in Europe, and it would be easy to do so. To send it to people, to young members of this society. You can count on that.
Okay. So with your permission, we'd like to kind of share the full research proposal and the copy of the survey for some comments and ways
Great.
to disseminate it in Europe.
Okay. It will be very interesting. I'm sure of that.
Thank you. All right. That was it. So we can move on now.
Okay. You asked, how do you keep teleconference and or other meetings efficient? Well, this is a weakness in my case. I do not have much time for conferences with my colleagues, and I neglect this aspect of motivation. So maybe I should learn to use this web tool you are using in CAPER. But I usually use emails and WhatsApp. We use WhatsApp also for our studies to have a very quick contact with the study collaborators if the study is not very have very high number of centers. But this, well, it's a weakness. I do not program, I do not set schedule conferences, and that I think that would be nice to do, but it's difficult for me. I have a big problem here in Alicante because I'm alone. I'm just one person making research, and it is difficult sometimes to get time for everything. But I think it's something that I have to advance on that. And finally, what are the top situations we can build connections for collaborations? Look, collaborations are always welcome and are great opportunities to meet people, to become friends of other people, to see how other people works. I have in the States three people that I have collaborated with a lot. Georgios Papachristou from Pittsburgh, Vikesh Singh from Johns Hopkins, and Li-Cheng Wu in Los Angeles. And I have great experiences with them, among the best I ever had. And you have to make collaborations with people you feel well with them, and that they are doing things that are interesting for you. This is always good. We are currently working on a patient-reported outcome measurement scale in acute pancreatitis, the PROMISE study. This is an international study that has already included more than 300 patients and will provide an interesting database with the main symptoms from patients with acute pancreatitis. We also have quality of life data. You are free to join the project. And as I said, the database will be offered to collaborators for collateral studies. And then we have the Pancreas 2000 educational program in Europe. This is also a good opportunity to collaborate. Look, 30 trainees from all over Europe are divided in groups of 5 to 7 people and are assigned to collaborative studies, one study per group. And it could be interesting for you to consider joining some of these studies. The stronger we are, the more ambitious projects we can try to do. And if you make connections now, you will have connections in the future to develop your own projects and very interesting initiatives like the ones that are making the Dutch pancreatitis study group, that they are very strong because they have a way to collaborate that is perfect, and they are changing real clinical practice. And I think we all have to learn from them.
Very impressive about like how much research you are able to do with the resources available. A few
Yes.
questions and follow-up things. And to use this tool, the web tool that we are talking on right now, so this can be used for your own research once approved by CAPER. So you can let us know. I'll send you an email about how to use this with your collaborators to make it much better, the conference calls. And the second thing is Pancreas 2000. So for Pancreas 2000, I was very impressed by like the program they had, and I actually applied for it. And I got the letter from my program director. I got everything ready. Then I sent in my application. then they said they only accept European applicants. I was so disappointed. I was so keen on like working with the European colleagues, but in the rule, like why is it so restricted to European students only?
Okay, Venkata, look, in the future, in 2 years' time, I am a mentor of Pancreas 2000, and I can bring my own student to Pancreas 2000. So in a 2 years' time, you are willing to try to do so, just write to me, because maybe you can join me to be included in Pancreas 2000. You are a very clever man and a great investigator, and I think we would need people like you, and I think it could be, we can talk with the organizers.
Yeah, it will be nice. Like invariably, like we will also, like Peter and I, like and our team, we will reach out to your trainees in Pancreas 2000 and in the EPC, and we would like to interact more with our European colleagues.
Yes, I think this is very important. I'm currently in the APC Council as representative of this of the young platform of pancreatology. So I think it's a very good moment to try to make things together.
So another medical student joined us on the call. Daniel, would you like to introduce yourself to Dr. De Madaria? Maybe he's not able to hear me.
Hello?
Hello, Daniel.
Yeah, hi.
Can you guys hear me?
Yep.
Yes.
Okay. Hello. I'm Daniel. I'm a first-year medical student here at the Ohio University Heritage College of Osteopathic Medicine. And
Nice to meet you, Daniel.
nice to meet you.
So when I told Daniel that a renowned pancreatologist from Europe is joining us, he was very excited. He said, "Wow, we didn't realize this forum included famous people from Europe," and he was very excited to join us.
Well, no, I don't know if I'm famous, but
Anyway, okay. So I guess our desire actually as part of the committee is to meet friends in Europe. That's kind of one of our priorities at the moment, because the committee is consisting of mostly, all of us are from the United States. And as you alluded to earlier, Dr. De Madaria, that the key to successful collaboration is to really get to know each other and from people from as many different continents and countries as possible. And that's kind of our weakness at the moment. If you have anybody in mind that would be interested in, getting to know us a little bit, we would truly appreciate getting to know them too, and getting involved in some collaboration.
Okay.
Yeah,
I will think about that. It would be very nice to have somebody from Europe to be in your committee. Right.
And I think one of the strengths of trainee-driven research is that although we're not professionals, time is something that I think trainees have more than the faculty and attending physicians. So I think this platform could be used for some really important work. So
I'm sure of that.
Yeah. Okay. Now this is an open forum, so anybody on the call, anything you want to discuss or talk about, now is the time to do it.
I have a question. So you said that you did some training in research methodology. What is your advice for trainees who don't have research methodology training and are trying to construct a study? Are there any resources you recommend that we go to?
Well, if you do not have a proper, you're not trained in methodology, you can rely on somebody who knows methodology, but you have to look for the best. You have to have a good advisor regarding methodology. But if you like research and you want to make your own projects, you have to start learning statistics, because you know there is a moment that is very, very important, and is the design of the study. Because I have seen many studies that are not well designed, and if the basis is not strong, the whole thing you will make a great effort to do something that will not be published in a good journal and will not answer properly your question. So there are many resources. You do not have to, you can learn by self-learning, but you need to control statistics and methodology if you want to make a successful career in research. It's very important. I did a master, a 4-year master. It was hard for me, but it was very, very important to make good research.
I ask that because I think it's kind of a challenge sometimes. When you're a trainee, you get assigned this project. Oh, let's do this retrospective study on something or a chart review. And it's a great idea, but then you're kind of left trying to figure out, well, how do I do this? And it's not like we get
Yes. You need a good advisor. And the best, there is a problem with advisors. The problem is that you are good in gastroenterology, the advisor is good in statistics, but then you need to have the whole vision of the study, because sometimes the statistician will not know which of the variables may be confounders, and if you do not have skills in statistics, you may not include some variables or some useful data that you will need in the future. So you need a good advisor, but try to learn. Well, I have to say that when I finished my fellowship, the first study I published that was designed by me was 6 years later. I had a long way to walk until I was able to do good research. It's not a quick path. You have to work, and if you do not have time, I would advise you to dedicate a very short period of time, but every day, to learn some statistics. For example, half hour a day. Then if you try to do it every day, you will have a good vision of statistics in 1 or 2 years, and you do not have to do an educational program to do so, just to learn and to have advice.
Okay, thank you.
You're welcome.
Anyone else have any questions? Medical students, you guys, do you have any questions?
Well, I was just going to ask for, I guess, Daniel and I, who are medical students and I guess a couple of years away from kind of making those decisions, would be your best advice in terms of, opportunities that we should be looking forward to, or maybe classes that we could take that would prepare us well for kind of a career in research?
To be involved with a team that have clear aims, and that you can check that if you work with it, that other medical students have first positions or good positions in these papers. To be involved in a good team with a good leader, a trustful leader, is very important, because you will learn quickly the basis of research, you will have publications, and you will start your career. and you will have contacts. So it is very important, maybe not to go to the best team of the States, but the team that has a very good leadership, a very good leader that is trustful, and that you know that if you work with him or her, you will have papers and you will have contacts. For example, my experience with Vikas Singh from Johns Hopkins and Georgios Papachristou, for example, are that if you work with them, you will publish, and well, Venkata knows that. There are trustful people. You have to look for that. That's my advice. Here in Spain, things are very different. You do an examination and you have a position in the examination, and then you can, the first one can go to the public health hospital he or she selects. So things are different. In the States, my impression is that.
Okay. Thank you.
Anyone else?
I wanted to ask a question about something we were talking about earlier regarding designing a data collection tool, often with, you know, many variables that are can be subjective. Do you have any advice for, you know, when multiple people are involved in data collection, you know, the best way to try to keep it consistent? Whether you do that, do you do it best to do it in person or with very specific details, or what have you found some useful things to keep the data consistent?
Yes, this is a very difficult task. You know, REDCap, it's a very nice tool because you can set logic rules for everything. You have to learn this tool before you start using that, because if you know how to deal with REDCap, you will have a lot of tools to use and to develop, and you need advice from somebody who is professional in REDCap to help you to set rules and tools to help you automatically to clean the database. But then you will have problems with people entering data, and you need somebody to look at the records. And this is difficult. Sometimes you need grants, or you have to use your, if you are doing your well, for example, I am not able of doing so in my database. I need help, so I'm the senior authors in the paper, and this task is for the first author of the paper, that is usually a trainee, a gastroenterology fellow, who will use this as a doctoral thesis. So he has responsibility in the study, but this is very difficult, and sometimes you don't know how to manage when we are talking about many patients. So my advice is to learn the tools you have, the web-based database you will use, and I advise you strongly to use REDCap for research. It's a very good. I love that tool.
Thank you.
You're welcome.
Anyone else?
And Dr. De Madaria, a more of a follow-up question. So again, regarding Pancreas 2000. So we are trying to make something similar in CAPER called the CAPER Scholars. So we are trying to bring some trainees together, and just like in Pancreas 2000, how you have 5 meetings over 2 years. So Dr. Walter Parr is trying to have something developed here through CAPER for the American trainees. So once we start going with that, we might contact you to understand Pancreas 2000 better, so that we can replicate a few things here. Okay, but also I would like to, well, I am not the organizer, I'm just a mentor in Pancreas 2000, but I am sure that Matthias Lohr and Thomas Gress, that are the coordinators of Pancreas 2000, would be delighted to have one of you in the next, the next Pancreas 2000 meeting is next week. So there's no time for that. But look, the first, here in this month, this course will end. It is a 2-year course.
And the next course will begin at the end of this year. It would be very nice if some of you could come to this first course to see we have often invited people to attend our courses, and it would be very nice if you could come to see how the project is developed and to learn from the basis.
Yeah,
So
we will be very
you are
interested too. So I
interested.
contacted Dr. Lore from Stockholm, right? He's from Stockholm.
Yes, from Stockholm. He is the alma mater of the project with Thomas Gaslander, and they will be very, very happy to do them.
Okay, so after this call, I'll talk to you, like I'll communicate with you through email, and we'll figure out a way to get in touch with the organizers of Pancreatic.
Dr. De Madaria, are you coming to DDW?
No.
No,
I'm not coming.
okay.
I'm now very involved in the UEG, so I stopped from going to DDW from 1 or 2 years ago.
Oh, okay. Okay.
It's a pity because it's a very, very good meeting.
Yeah. It would have been nice to meet you in person.
Yeah.
For those of us that are going, so. Okay. Anyone else have anything to ask? Dr. De Madaria, do you have anything any last pieces of advice or questions for us as trainees?
I think that you should keep developing this committee and to do this kind of Pancreas 2000 in the state would be very, very nice. And I think we could automatically have joint projects and to collaborate. And I think you are doing things very well. So I wish you luck with this kind of projects.
Thank you very much. Well, thank you so much for your time.
I actually have one more question. I'm sorry, Peter. So I actually have one more question. I was just curious to, so you talked so much about REDCap. So for us in United States, with all those universities, so they have an IT department, they have already organized everything. So we have servers where we can host REDCap. But how did you get REDCap, and how did you start up REDCap as a hosting center?
We have a node in the Spanish Association of Gastroenterology.
Okay, I mean, did you have to pay anyone, or did you have to set up a server for that?
No, the Spanish Association of Gastroenterology pays for that, okay? And you can apply to use it for free if you do not have money from grants to pay it. So I use REDCap in 2 studies right now for free, thanks to the Spanish Association of Gastroenterology.
Okay, so was there any dedicated IT person designated for it and all the hardware, or you just go talk to Vanderbilt and have it set up, pay them?
No, the Spanish Association of Gastroenterology has 2 people that are dedicated to REDCap. I learned from them the basis of REDCap, and it's a very easy to use tool. I am not used to advance REDCap with logic rules, and I would like to know more about that, but for me it's very difficult to spend time in those tasks. In the future, we would like to have some study monitor from a grant or something to help us develop projects, because it's very difficult to keep our research tasks properly.
Yep. So I mean, the big reason for success of Apprentice was the REDCap. So yeah. I'm trying to set it up in some of the Indian facilities here, the REDCap. So I'm trying to figure out the logistics regarding the hardware of it. But that's very interesting, like how you are able to use it more too.
It's a very good tool, and it's fantastic. It's a fantastic tool. Mm-hmm.
All right, Peter, so I'm done with my questions.
This is great. This is great. More questions, the better. Well, Dr. De Madaria will keep you posted on some of the things that we are up to so that we can hopefully engage your expertise and experience in the future. But yeah, just on behalf of the group, we just want to sincerely thank you for your time.
You're welcome.
Yeah, and hopefully we'll get to meet
Very nice to talk with you, and thanks for inviting me to do so.
Thank you very much. Well, you have a wonderful evening.
Okay, see you all.
Thank you.
Everybody.
Bye.
Thank you.